Today we're going to talk about PRP treatments for the scalp. So what is PRP? PRP stands for Platelet-Rich Plasma. So it's your own blood. We spin it down, we draw the blood, spin it down, and the red blood cells go to the very bottom and you just draw off the clear yellow platelets off the top. This is not a regular blood draw tube. There's actually an ingredient there that activates the platelets, the 17 different growth factors that are in the platelets, and then we inject that growth factors back into the scalp, and that's what helps grow the hair, stimulates hair growth. It's not right away, so we do treatments every month for 3 months, then we wait 3 months and do that fourth injection at month 6. I'm going to show you some examples of patients that I've treated. The pictures are 6 months apart. These people did do other things besides PRP as well because we were trying to maximize our results, but I just find these interesting. My favorite one is this one. When people say, does it work? I'm like, well, it may, but this is interesting. As a patient, she's 9 years old and she wanted to do this treatment. I was like, I have not done this in somebody 90 before. I don't know if this is going to work. I can't guarantee it. She said, that's all right. I want to spend my kid's inheritance anyway. I'm like, okay, let's try it. Let's see how it goes. So this was her to begin with, and you can see it's very thin. So we could even see through her hair into her scalp. Very thin down here, not a lot of volume and things. And we tried we did the PRP treatments in addition to some oral treatments and things like that. And then here we are 6 months later. I was like, this actually worked. So we can see she's got a lot more volume down here, and it is harder to see her scalp. So she did actually get quite a good result from PRP treatments. I'll show you another example because I think it gets confusing when you're evaluating pictures of PRP because you're like, well, did the person just get their hair cut recently and when they got their PRP, and then when they and then the after picture their haircut was just later and so they just have longer hair. This one's great because this is a patient that kept his hair shaved. So we're actually able to see really closely and see the changes in terms of how much hair he got. If you pay attention right here, and you will see what happens over the 6-month period. So here's before, here's at 6 months, and you can see all this hair getting thicker and more abundant right here. Here's the best part. We can do a close-up and you can see, focus on this area right here, and then you can see, look at that. Clearly he's getting more hair. There's no, it's not like, oh, it's just hair is longer or covering, but you can see the difference between here and here in terms of how much new hair growth he had. So it is an exciting treatment. It can work great for some people. I do like to combine it with other things so we can guarantee that we're trying everything at the same time to make sure we get good results for everybody. But this is something to think about if you're struggling with hair loss. Like, man, I'm doing all the right stuff, I'm doing all the normal stuff, and it's just not getting better. We can consider giving it a boost with this PRP treatment. So if you're interested in getting one of these PRP treatments, feel free to reach us here at Balcones, Dermatology and Aesthetics.